Good evening, everyone. Welcome to our season 1 of Health Ki Talk, where we are going to be discussing about diabetes and kidney diseases. And to talk about it, we have our guest doctor with us, Dr. Bhanu Mishra, who's a nephrologist with BLK Max Hospital. Welcome, Dr. Bhanu, to the show.
Good evening, Miss Shalini. Tell me.
And it's a pleasure having you. And I think diabetes is a very common problem which everybody is normally, right from kids to any age that is facing. So first we would like to understand what diabetes is and how does it affect the kidney in various ways is what, we would like to hear from you.
Diabetes is one of the biggest pandemic that we are facing. Corona is nothing in front of it. You have to understand that part. It's a silent killer. Every 1 in 3, every 1 in 5 people are suffering from pre-diabetes. That means you're going to suffer from diabetes, and a lot of people, 1 in 3, are suffering from diabetes already. Many of them don't even know because in India we are not usually following a health checkup plans that we usually see in the Western countries. So once we diagnose diabetes, there are a lot of things which diabetes hampers. So the initial symptoms that you need to consider about diabetes is if you're facing a lot of thirst, if you're facing a constant need to drink water, a constant need to eat, and a lot of urine if you're passing, what we call as polyuria, polydipsia, and polyphagia. So those are the initial. Second thing, we have to understand who will suffer from diabetes. So one is a very strong family history. So if your father, mother, your brother, sisters are suffering from diabetes, you are likely to get it if you don't follow proper precautions. Second thing you have to understand, if you're on the obese side, so if your BMI is above 25, if your BMI is above 30 especially, you're likely to suffer from it. So those two are the biggest risk factors, your family history and obesity.
So do you think
that is one aspect we need
as a lifestyle cause also?
Yes, this is a lifestyle disease, and the poorer the lifestyle, like we are in the urban countries, urban cities, we are seeing that people are having sedentary lifestyles. This is the biggest fault which is happening in current scenario, in the current era, that is predisposing our country to the diabetic pandemic. And India is already being called as the diabetic capital of the world. Our cases are rising every day. And we need to be very well aware that how to diagnose diabetes and how to keep it in control, either by medicines or by lifestyle measures or by food intake.
So you mean to say over the years, you think it is increasing over the years, or we had it and we never knew about it? I mean,
it is increasing. Both the components are there actually, because we had it, because the diagnostic capabilities, the financial capabilities and the awareness was less. Second thing, because of the recent lifestyle changes that a lot of people are facing. People are moving from rural to urban, less and less of walk, more and more of car and bikes and other travel means are coming in. People are getting, they are eating junk food, they're having sedentary lifestyles. All of that takes you to obesity with family history in background. More people are suffering from diabetes. And what we are facing is not just the 40-50, even the youngsters at the age of 30s are getting diabetes right now. So this is a big.
I know even the children are getting it. It's a very alarming stage, and I think it is for that parents need to be very aware of, right? As you said, from nutrition to how to handle it, right from I think probably the sports that the children should indulge in right from at a very younger age. So all these things, so plus nutrition will take care of it, right?
Yes. We need to be first of all have awareness about diabetes and kidney diseases at the same time. So if kidney diseases usually happens after diabetes, let's say if there are 100 diabetics, around 30-40% of them will get kidney disease. Not every diabetic will get kidney disease, but you have a strong family history where your father and mother had diabetes, they had kidney problems, you are more likely to have a kidney issue coming in.
Okay. So is it diabetes, a way that we can reverse it also, the damage caused on the kidney by diabetes? Can we reverse it?
if you catch it very early, if you catch it very, very early by routine testing, then reversibility is probably the wrong word. We can slow the
Okay.
progression. We can slow the
Okay.
progression by using diet and lifestyle. Plus, there are newer medications that are that are already in the market, which will help to reduce your progression to kidney disease.
Okay. So this is how, I mean, so at what stage, I mean, what do you think should be the diagnosis? What are the, tests that at what ages we should make sure that our body is functioning well? So how do you think is we can
If
take
you are a
care of that?
diabetic,
Like
if you
we
are a
catch it
diabetic
early.
already, yes, yes. If you are a diabetic already, I would sincerely request as a nephrologist, you should have at least 3 tests done once in a year. One would be a
Okay.
urine routine microscopy. Second thing to do your kidney function test. Third thing would
Okay.
be to do your ultrasound of the abdomen, which will see your kidney, ureter, and bladder. If we do it once a year, we are very likely to catch these problems early on and then tackle it accordingly. Especially there are two sets of group which are very under addressed. One is the elderly people of the house. So a lot of elderly
Yes.
people do get neglected. So especially in males, they get prostate and they get kidney problems. But diabetes causes more problems, so they becomes an add-on. Second thing, diabetic people, especially in females, they get urinary tract infections. That also needs to be tackled at the same time. So if you control diabetes, you catch kidney problems earlier, you are less likely to face other issues.
So what you mean to say is we need to get our tests done very regularly, because that is one thing which everybody feels, oh, I'm feeling fit. I don't think there's anything wrong with it. But actually, what we look on the physical side is not what we know is happening inside our body. So it is
Absolutely.
very
Absolutely.
important. So all the viewers, I would request you, as the doctor said, that you should get your test done at least thrice in a year. That's it's going to help you in every way, because
If
you
you
will
don't
be
have a
able to
kidney
catch
problem,
on.
once a year is good enough. If you don't have a kidney problem right now, once a year is good enough for you to test and consult your physician. Once a year is good enough. Before we move on, I want our viewers and listeners to understand one aspect, that you need to know what are the kidney problems and how they present to you. Not everybody will get symptoms. So you need to understand 60-70% of patients do not get symptoms till the time your kidneys are 70-80% damaged. But the
Okay.
people who will get some symptoms are little swellings in the legs. You might be getting them in the night multiple times for passing urine. Some frothiness in the urine, that after passing your urine, if you flush the toilet, you will still see a lot of froth around. That
Okay.
could be the initial sign of diabetes causing kidney damage. Second thing you need to understand, diabetes not only causes kidney problems, it has eye issues as well. So you need to check kidney as well as eyes every year. And if you have a eye problem, which is called retinopathy, the retina gets affected, you're more likely to get kidney problems as well. So if
Okay.
you need to keep this in mind.
Okay. So, is there any diet, that we can, which we need to follow? I mean, is there anything which you would recommend needs to be something which needs to be inculcated in our day-to-day nutrition and diet?
Yes, the simple thumb rule is watch what you eat. And
Okay.
by that I mean, whenever you try to eat your breakfast, maybe lunch, snacks, dinner, there is something which you need to keep in mind, something called as glycemic index. Now what is glycemic index? It is the capability of a food that you're eating which will increase your blood sugars immediately. So lower the glycemic index of your food, the better it is for you. Your sugar will
I
get
think we have
managed.
query at the moment, doctor. Let's just hear to it. Hello. Yeah. Hanji. Can you be a little louder, please? You are actually not audible at all.
I think what he's
Yeah, please.
asking is diabetic ketoacidosis.
Yeah, I think so. But he was not audible. He's
What he
calling
was
back
asking
again.
is about diabetic ketoacidosis, and that is a very dreaded form of diabetes, in which a
Okay.
lot of your sugars are very high. Your patient is very sick, is dehydrated, and I would recommend, if you feel your you get abdominal pain, vomiting, you're not able to eat. This is a very serious situation. If you are facing any symptoms and your sugars are above 500, or in your glucometer if it is coming high, it is better to go to the hospital emergency and get yourself treated. It is very difficult for a doctor to manage diabetic acidosis, and for me to give you tips on that on YouTube is very difficult. I would recommend you should go to the emergency and get yourself treated fast.
Absolutely. So that is what, actually this awareness is what we were talking about is very low, because diabetes is a very serious thing, yet people are not taking it very seriously. And, they try to manage it with maybe, at home, or, through their, but as you said, it is very important to consult your physician and, get the right diagnosis and the right medicines and the right
So in
way
the
to
diet,
manage.
in the diet, one thing I was saying was the glycemic index. So what you eat. Second thing, you need to understand a few thumb rules. You have to have a balanced diet. A lot of people in diabetes, there are a lot of food fats associated with it. That we should not eat this and we should not eat that. You need to see your food should have very low glycemic index. That's one. Second thing, should
Okay.
be balanced. You can have salads, you can have green leafy vegetables with it, some rice, some chapatis. A little low in oil and potato might do the job. Second thing, what you need to understand is there are a lot of marketing about the snacks that we eat on daily basis, that they are low in sugar, they are very light. I would
Yes.
want our listeners to understand that they should not fall prey to this kind of marketing, and they should see on their own the food that they are eating, what is the glycemic index of that food, and try to increase the number of ingredients in your diet which has lower glycemic index. So that's one. Second thing, what you need to concentrate is on fiber rich food. So more the fiber, the better it is for your gut health. You'll get
Yeah,
less.
we have a caller here. Yes, hello.
Hello?
Yes, yes, please.
मुझे सर्दी को पूछना है कि अगर प्रेगनेंसी में अगर जिसको डायबिटिक हो जाए तो उसकी बेबी को कितना इफेक्ट पड़ेगा?
The caller wants to know कि pregnancy में if she gets diabetes, how much is it going to affect the baby?
If you get diabetes during pregnancy, it is a very a serious problem to attend to, and many a times the patient needs insulin delivery. So if you manage that well, the chances of the baby getting harmed because of it becomes very less. But all said and done, if you have developed gestational diabetes, your baby is going to have two problems. One is the size, the weight of the baby might be more when he or she gets born, 3.5, maybe 4 kgs and above. So that can
Okay.
cause problems while delivering, and the other issues, gynecological issues, obstetric issues that we'll face. Second thing, that in future, the same baby might get diabetic earlier than what their parents had got. So
Okay.
these are the things you need to manage. So I would
So
request all
what
the
is it that she
female
can? So how is there any way that she can, manage it
yes,
and
when you're planning pregnancy, that is the way. When you're planning pregnancy, you should try to reduce your weight first, try to get into better shape, and then plan your pregnancy. That will
okay.
reduce the risk.
And plus, I think, get all your tests also done, as you said, so that you are
Yes,
aware of any problem that you're facing and you can tackle it first before you plan your pregnancy.
absolutely.
Right. So,
Monitoring is the way ahead.
yeah. Absolutely. So this is, these are that's what, these are very small things. I think, people are not aware of. Like she asked about pregnancy. There are so many things because, nobody is there to tell them exactly what they should be doing. So through this program is not, we are trying, trying to give this awareness to people. So we would like more callers to just, call on the given number so that any query that is there is taken care of right away.
One
So
more
till
thing which
then,
I want to highlight here is the activity level that you have in a day. So around, on a rough rule of 10,000 steps per day should be followed at least.
okay.
If you are able to take up 10,000 steps per day, the chances are you will get diabetes less. Second thing, you need to, at least if you're not able to count your steps because you're busy in your lifestyle, at least 5 days a week, 45 minutes of moderate exercise, which will include some
Okay.
swimming, jogging, cycling, gardening maybe. So at least 5 days a week, 45 minutes of exercise in which you will, have some sweat. That might actually be very helpful in
Right,
covering up
so
these
as
kind of
we
issues.
always say for any problem that we face or we might face, exercising and being active is very important, because sedentary lifestyle will lead to a lot of problems, and plus the food needs to be taken care of, as you've been mentioning. So tell me,
Third,
over the time that we saw,
third,
yeah,
yes.
yeah, please.
Third thing which I want to highlight here is, especially when we just spoke about the young people getting diabetes, and the young people are also prone to get addicted to a lot of smoking, alcohol, junk foods, the beverages which are not supposed to be taken, like Coca-Cola, Pepsi, and these kind of things. They get very fast addicted to the same. So the addictions absolutely have to go out. Like smoking and alcohol should be stopped altogether. Smoking definitely is a big no. So it will cause faster progression of diabetes, faster kidney problems, and your vessel health, the vasculature health of your body, your big arteries, your big vessels get affected with smoking very fast. So addictions are definitely should be avoided at all times. And I would like to highlight this by saying the modern cocaine is the salt and sugar. We are so much addicted with salt and sugar that if we try to reduce it, we feel very less energetic. I see a lot of patients in OPD saying, we have reduced salt in our diet, but we feel, we have not completed our food. We feel very weak when we have decreased the salt. That is actually the high that the salt is giving you. So once you are through this journey where the initial 1 month, if you are able to cross with low salt and low sugar in your diet, after that you will start feeling much better. So these are very addictive stuff, salt and sugar, much more than what I would say drugs.
We have another caller. Yes. Hello. Yeah. Diabetes and okay, hepatitis C. Yeah. Is there any link between diabetes and hepatitis C?
Hepatitis C is known to cause liver problems and known to cause immunological issues in our body, and it is also known to cause kidney problems.
Okay.
So it has interconnected liver, kidney, and pancreas. So they do get sometimes affected. And diabetic and hepatitis C, the way it spreads is through blood. So if you get yourself checked often, and you don't do it from a proper center, if you get hepatitis C, it will be a big problem. Your kidneys will have two front runners to fight. One is diabetes, another is hepatitis C.
Okay. So these are, and what are more, what you stress on, what are the more problems that we can face with diabetes? Other problems, apart from these?
Diabetes, one is the kidney problem. Being a nephrologist, I can tell you it's a big issue. Most of our kidney patients are diabetic. If you see the dialysis population, out of 100 people, around 50-60 will be diabetic. So most of our patients who are on dialysis dependent are diabetic. Second thing the diabetes affects is your heart. So your heart needs to be evaluated, especially if you're above the age of 40, every yearly by doing an ECG or maybe a 2D echo, and if you have any symptoms. Third thing it affects is your retina, as we spoke just now, that you have to check your eyes, retina you have to check. Third thing it can affect is your brain. A lot of times you get stroke. So diabetes is known to cause that. Third thing that it does is your diabetic foot. I really want to highlight that point. Diabetic foot is something which is very less highlighted, and a lot of people don't pay attention. I would say every diabetic, before they sleep, make sure that you check your toes, you check your sole, and see if there are any minor wounds there. If you do that every day, you will be saved from a lot of trouble, because small ignorance there can cause ulcer, and those ulcers don't heal, and it becomes a big problem. So you should check your feet daily.
Can you stress it on a little more, because this is something which everybody can check at home. So can you be a little more elaborate on this?
To make it understand, when I see a diabetic patient and their children with me, I tell the children, रोज रात को अपने मम्मी पापा के पैर छू के सोना है. By that I mean, if they should, when they touch their feet, they should see between their toes, and you should see between their toes and see if there are minor damages, scratches, which happens to everyone in our day-to-day routine. If they have it, you should treat it as if you have an MI. What I mean is, MI is myocardial, as you have a heart attack. So if you have those kind of wounds, treat them immediately at home with home remedies if you have. If you feel that it is, you're not able to handle it, consult your physician. They will guide you through.
Okay.
Because if you treat them right away, it will not become an ulcer and become a problem. I have a patient who
Okay.
is right now admitted with me, who had a small boil, and they did not pay attention. Sugars were not controlled, and they scratched it off, and the whole area has become gangrenous. So it becomes a real big problem. So if you don't pay attention right on time.
So that is what it is like, catch your disease young before it gets a problem to everybody and to
Absolutely.
yourself. So it's very important to get your diagnosis done. Get just pay 10 minutes to yourself every day by monitoring your body, just checking out that if you see anything that you feel is not up to what your body should be, please get it checked with your physician or with somebody whom you trust as a doctor. And please don't ignore these things, because these small things actually can lead to major problems, and as the doctor said. Yes, so now we would like to also ask you about the kids. When the kids have diabetes, how do
Well,
kids handle it? What are the parents, how should their parents, mother, father should take care of to handle this with the children? Because this is an alarming thing for them also.
yes. One thing I need to highlight is the longer you have diabetes, the more likely you're going to face complications to it. So children getting diabetes, they're going to live for next 50 years, 60 years. They are likely to face all sorts of complications of diabetes. So if your child is diabetic, you need to find out whether it's type 1 or type 2, because there's a managerial issues to manage both of them. If your child is thinly built and it is very active and still has diabetes, it possibly would be type 1. As a thumb rule, there are a lot of caveats in this, nothing is,
Yes.
but
Yeah.
as a thumb rule. And the second, if your child is a little on the fatter side, a little less playful and sedentary lifestyle, then likely it could be type 2. So just a broad thumb rule for people to understand. If you have type 1 diabetes, I would say it is better to get in touch with your physician, your endocrinologist. It is very difficult to manage, and especially at young age. If you have type 2 diabetes, and like we spoke before, the children need to be very active. Make sure that their screen time is very low. Children are very addicted to your online streaming and their mobiles and YouTubes and tabs. Screen time has to be low. They are supposed to go out, play. Physical activity has to be there at least an hour per day. And of course, they have to watch what they eat. They're very difficult to tell children not to eat this and that, but you can fix times. Give them a cheat day on a Sunday and tell them to eat right out for the next 6 days. That might help.
And I
Second
think
thing I
for
want to highlight about diabetes is the insulin use. A lot of people are very afraid of using insulin. Those times are gone where the needles were bigger, they were broader, the pain was too much. Now the needles are very, very thin. You'll not even feel, they are thin as your hair, and it is very easy to use these days. So please don't be afraid of insulin. Insulin is your friend. And if you use insulin, insulin is the best medicine if you have kidney issues and diabetes coming together. Your sugars will get controlled faster, your HbA1c will get controlled better, and your outcomes will become better. So don't be afraid of insulin. There are better insulins now. You have to just inject once a day, and it will really help you.
Yeah, we have a caller here. Yes, hello.
What is juvenile diabetes and how it affects children?
No, come again. हाँ जी, दोबारा बोलिए.
What is juvenile diabetes and how it affects children?
What is juvenile diabetes and how does it affect children?
See, in diabetes, the nomenclature has been changing quite a bit. What we need to understand as patients, because if I get technical, it becomes, this is probably not the place for it. But what you need to understand is juvenile means in the younger age, like we just spoke. So there could be type 1 and type 2 and juvenile diabetes, and there are many nomenclatures to the same thing. What they need to understand is what they can do as patients is to keep their child active, make sure that they eat low glycemic index foods, and they're very oftenly followed by an endocrinologist or a physician. That is all they need to understand at this point of time. The customization to every patient is different. You need to understand. You cannot your relative, your neighbor next door is eating some medicine, and because you're also diabetic, you can take that. Is definitely not the way ahead. everything needs to be customized to the patient, to their needs, their social and economic structure. So please consult your physician before we talk more about your treatment.
Absolutely. Because yes, every body type is different and the problems related also within your body are different. So yes, you cannot have the same medicine that the other person is having. So it's very good that you consult your physician, consult your nephrologist and go by the right diagnosis. Do we have a caller?
Second thing that we need to understand is about the painkillers. I want to highlight. A lot of diabetic patients at the age of 40, 50s, especially in females post-menopausal, they get a lot of bone ache, myalgias, body ache, and they tend to take over-the-counter pills. Those over-the-counter pills like Brufen, Diclomol, and other local brands that we use are very difficult for the kidneys, and their kidneys do get damaged. So please avoid over-the-counter pills. If you have pain, paracetamol can be used easily, which is almost harmless. And if your pain is not going through paracetamol or maybe by local application of any gel, it is better to consult your physician about or your orthopedician why you are getting pain and get it yourself treated. Because if you take painkillers very often, those are very strong painkillers. You will get relieved of the pain and then you will get addicted. Whenever you will have pain, you will eat the painkiller. In long term, especially a diabetic who has diabetic definitely will get a kidney problem if they don't take care of what they eat.
Hello.
Yes.
Madam, could you please correct me to Dr. Bhanu Mishra?
Yeah. You can please, you can put in your query.
Yeah, my query is, when should the insulin be started?
When should insulin be started, doctor?
Yeah, when should it be started, and what would be the best insulin preparation, the latest insulin preparation?
And what will be the best insulin preparation? Can you highlight on that, please? For type 2?
Yes. There are two. The newer insulins that we have are the Glargine and the Degludec, which comes by the name of Lantus and other things. These are the insulins which are newer insulins which we use once a day. And then there are other insulins which in the glutide group which we can use once a week. But the cost of that is very high. So in the general population, if we speak about, we can use insulin like Glargine and Degludec, which can be used once a day at a fixed time. No need to connect it with your meal timing because it becomes difficult. That is one. The question about when you should start insulin are the 2-3 areas where you should. One is your HbA1c is uncontrolled. Even after you have followed whatever best of diet and best of exercise, and your sugars are not getting controlled. Even if you have exhausted your oral medications, there are 3-4 types of oral medications which we can give. Even after that, your sugars are not getting controlled. Insulin is probably the way ahead. Second thing, if you have a kidney problem, it is better when you have a kidney problem, the oral medications, there are limitations to what oral diabetic drugs we can give. So that is one area where you should start insulin. A second thing, if you have infection. If you have infections, when you are in the hospital, the doctor will take care. But let's say if you are managing it at home, insulin is probably a better way because you are able to manage your insulin, manage the timings of insulin, and infections to get controlled better with insulin. The sugars get controlled and the infection secondary to that will get controlled better with insulin. So I feel these are the 3 big areas where insulin should be started immediately.
Okay. So what will you say, before we wrap up? I would like to ask you is the general tips that you would like to give to anybody who is, thinking, maybe, feeling that they are going to be diabetic or they're already diabetic. So what are the tips that, on a general code you would like to say that they need to follow in their day-to-day routine?
You have to remember a few S's in yours.
Yes.
S, the sugar. There are a few S that you need to remember. First is the sugar. You have to eat less sugar. Second thing, low salt. So the second S. Third, like we spoke about, smoking. No smoking. Fourth, sedentary lifestyle. So these 4 S's have to be taken care of. If your lifestyle is good, you're not sedentary. If your salt and sugar is less, if you're not smoking, these are the 4 big tips I can give you at the end of the talk. If you follow this, your sugars will get controlled. And if you have kidney problems, these are very complicated issues. Everything needs to be customized to your needs based on your social and economic strata. So please consult your physician and get yourself treated fast. Annual checkups are the way ahead.
Thank you so much, doctor. It was very, very enlightening to hear to you about kidney and the diabetes that we get. They are interrelated, and yet they need to be taken care of. So I'm sure our callers will be very. They must have got very good information from it, and we will come back again with another issue that diabetes patients face. So till then, take care and have a good day. Thank you so much,
Thank
doctor.
you. Thank you. Good evening.